So hello friends, in this video we look into the questions that I have collected from the topic that we have till now discussed. So if you have seen my previous two videos, or if you have done this particular skeletal system part on your own, do make it a point to solve these questions here. So you can pause the video in between and then solve the question and then find an answer before you watch my solution for each and every question that I am presenting here. Okay, so let's go to the first question now. So this is the first question. Sutures of the skull bones are examples of. So we know that there are multiple skull bones. Now they are actually joined with the help of sutures. Now they are immovable. You cannot move the skull sutures between the frontal bone and the parietal bone, between the two parietal bone, between parietal bone and occipital bone, temporal bone. Nothing can be moved there. So there is no movement at all. No movement at all. So this is fibrous joint. Okay, so the correct answer for question number 1 is answer 1. Okay, so this is the fibrous joint. So there is no movement here, and the bones are connected with the help of dense connective tissue. So this dense connective tissue doesn't allow any movement. Cartilaginous joint, the bones are connected with the help of cartilages. Example is vertebrae. So if you have vertebrae, two vertebrae over here, in between you are having an intervertebral disc, and this is made up of cartilage. Okay, so the intervertebral disc is made up of cartilage, and this is a vertebrae, this is another vertebrae. So this is example of cartilaginous joint. Synovial joint means if this is one bone and this is the another bone with which the bone is making a joint, there is a kind of synovial membrane over here, and the synovial membrane surrounds the joint. This joint has a synovial cavity which is filled with synovial fluid for shock absorption, nutrition, etc, etc, etc. Pivot joint is a type of synovial joint. Okay, so I hope you have got the answer here. Fibrous joint, no movement at all. Cartilaginous joint, limited movement. Now synovial joint, high movement. So this is how you will differentiate these things. Let us go to the next question now. Okay, so this is from the topic of girdles, pectoral girdle. So collar bone is known as. So we know that in the pectoral girdle, if you have pectoral girdle, okay, you have two bones over there, clavicle and scapula. Remember, clavicle is the collar bone, or I can say the shoulder bone, collar bone. Okay, so this is where the clavicle is there. Okay, it is a horizontal bone, it is a long bone, it is also called as the collar bone. Sometimes it is also called as shoulder bone. Now scapula is called as the shoulder blade. Okay, so obviously the correct answer for this question is option number 4. Now what else is there? Scapula, shoulder blade. Patella is the sesamoid bone. This is the sesamoid bone which is formed by ossification of tendons. It is present in the knee. Okay, but in the elbow you don't have any joint, any bone like that. Okay, it is present in the knee. So this is the bone that is present in the knee. It is a sesamoid bone formed by ossification of tendons. Ischium, ilium, ischium, pubis. These are three parts of the pelvic girdle. This is a part of pelvic girdle, and acromion is a part of the scapula. So if I just make a rough representation, scapula is like an inverted triangle. It is between the 2nd to 7th ribs. It was asked in this year's NEET exam. Okay, 2nd to 7th ribs. It extends between the 2nd to 7th ribs. Now here there is a small projection like this. I mean, there is a ridge like structure that is called as the spine. In the top it will form this particular acromion, and below this acromion comes the glenoid cavity. This is attaching to the humerus. This is the socket, and humerus, head of the humerus is the ball. So this is the ball and socket joint. Okay, now here this clavicle is coming and attaching to the acromion. So this is the clavicle, this is the acromion, and this is the glenoid cavity which is attaching to the humerus. So clavicle comes from the front side, it attaches over the acromion. So this is the acromioclavicular joint, or this is the clavicle attaches to the acromion. That's it. Okay, so this is how the whole thing is arranged. So I hope you got the answer for that question. Let us go to the next question, which is slightly interesting in a way. See, which of the following body part has more number of bones than others? Maximum number of bones. Okay, skull, actually in textbook it is written 22 bones are there. Okay, now these 22 bones can be divided into cranial bones and facial bones. There are 8 cranial bones and 14 facial bones are there. Now along with that I would like to add 6 ear ossicles, okay, and hyoid also. Hyoid is present in the neck. We have discussed everything. Okay, in 1 year you have 3 ear ossicles in the middle ear. So in 2 years, 6 ear ossicles. So 6 plus 1 is 7. 7 plus 22 is 29 bones altogether. But in the textbook, totally they have just written 22. Okay, actually it is 29. So remember 22 for the exam. Or even if you remember 29, it is okay for solving this question. But in the exam, if they are asking you the number of bones in scholars, obviously 22 is what is written there. Now chest, we'll see this is the number of bones that we have now got here. Okay, chest is actually, you can take it as one sternum. Now, chest, actually what they're meaning by chest is this front side of the chest only. So you have one sternum plus 12 plus 12 ribs, isn't it? So 24 ribs are there. Okay, 24 plus 1 is 25 bones. Okay, since they are just mentioning chest, I will like to consider only these bones over there. Now if you consider the whole thorax as such, then you have the vertebrae also behind, isn't it? So vertebrae are 12 in number, 12 thoracic vertebrae are there, and then along with this 24 plus 1 is 25. So 25 plus 12, that will give you the total value. But since they are just mentioning chest here, I would like to consider it as this anterior chest only. Whenever they say chest, it is this particular part only. Okay, when they say chest, you don't consider that back portion. So obviously this is the chest. So you have 12 vertebrae, 1 sternum, 25 bones. Next is forelimb. I told you that any limb 30 bones. Okay, girdles, they have not mentioned pectoral girdle or pelvic girdle. If it is pectoral girdle, if you are considering pectoral girdle, and if you are considering pelvic girdle, let us see what is there. Okay, in pectoral girdle you have clavicle, scapula, 4 bones. Okay, pelvic girdle, ilium, ischium, pubis on 2 sides, so 6 bones. Okay, so these things were discussed in the previous video. That is why I am not going into detailing of these kind of things. I'm just quickly going through the questions. Okay, otherwise this length of this video will become considerably higher and nobody will watch that much lengthy video. Now face, as I was telling you, skull, 22 bones in the textbook, 8 and 14. This 14 is the facial bones. Now tell me how many bones are there, maximum, which is the maximum number of bones. So I found that 30 bones is the maximum. So that is there in the forelimbs. Answer is option 3. Okay, this is a good question. I hope you have understood how did I calculate everything. Here chest means this front side of the chest. 12 vertebrae, 1 sternum. So 24 plus 1 is 25. That is how I calculated everything. Pectoral girdle, 2 bones in each side. Clavicle, scapula, 4. Pelvic, there are 3 bones on each side. Ilium, ischium, pubis. Total is 6 on both sides. Okay. See, ball and socket joint is fibrous, immovable, slightly movable, synovial joint. Fibrous joint, there is no movement. Okay. Movement, and the 2 bones are separated by dense fibrous connective tissue. Now, immovable joint, fibrous joint. So, fibrous joints are those joints which are immovable. There is no mobility. There is no movement between the bones. And example is the skull sutures. Slightly movable joints are cartilaginous joints. Fine. Now, if you know this, cartilaginous joint is, example is the vertebral junctions. If this is one vertebrae, this is another vertebrae. As I was telling you, there is an intervertebral disc over here which is made up of cartilage. This is an example of cartilaginous joint. Now, synovial joint, yes. Synovial joints are actually very much movable. Now, examples of ball and socket joint, hip joint and shoulder joint. Okay, hip joint and shoulder joints are very much movable. There is mobility which is possible. I can move my shoulder joint, I can move my hip joints. So these are synovial joints. And you know, you have a list of synovial joints. Okay, ball and socket joint, pivot joint, the saddle joint, gliding joint, that joint, this joint, many other joints are there. So that is given in the textbook, and we have covered everything in the previous lecture. So yeah, even this next question that you have here, the joint between the carpal and metacarpal of the thumb. Okay, so this is an example of saddle joint. So correct answer is option number 3rd. Okay, so hinge joint, pivot joint, saddle joint, fibrous joint, gliding joint. The fibrous joint, you know by now that example is skull sutures. Okay, gliding joint is between the carpals. Carpals are present on the wrist. Okay, these are the carpals. Now the carpals will be 1, 2, 3, 4, 5, 6, 7, 8. This is how the carpals are arranged. Roughly, this is how the carpals are arranged. So in between the carpals, there can be some kind of a gliding. Okay, this is a carpal, this is another carpal. This kind of a gliding is possible, but it cannot go away from each other. They are arranged as a plane area, isn't it? That is how you need to remember this. So gliding joint is the joint that is there in the wrist. Now between the carpal and the metacarpal of the thumb, so between the carpal and the metacarpals are forming your palm. Here comes my metacarpals, 5 metacarpals. So from the carpal to the metacarpal of the thumb. So this is the area of the joint. This is the metacarpal, this is the carpal. So this is the area of the joint. This is the example of saddle joint. Okay. Pivot joint is, I can write it here. Pivot joint is present between atlas and axis. Axis is the second vertebrae, atlas is the first vertebrae. Now let me tell you, this is how the second vertebrae looks like. It has a small projection like this. You will call this as the odontoid process or the dense process of the second vertebrae, and the first vertebrae is arranged over here. Okay, so the first vertebrae, if this is my second vertebrae, this is the pivot, or I can say here the correct word is odontoid process, which you don't have to remember. Now this is the first vertebrae, it will be attached over here. So this kind of a movement is possible over this particular pivot. Okay, so that is how the whole thing is there. So this is the pivot, the first vertebrae is over this and it can move over here. Okay, so I can move my skull in this particular direction because of this joint. So that is the pivot joint. Okay, remember this particular example between atlas and axis. Right. So yeah, with this we have discussed almost all these things here, and every other joints we have discussed in the previous lecture. Next question is of the topic of again pectoral girdle. Glenoid cavity articulates with. So if this is my scapula, there is a glenoid cavity here and it is an inverted triangle extending between the second to seventh ribs. Very important question. Okay. Now here there is a small ridge-like structure. This is called as the spine of scapula. Spinous process. On top it becomes a flat process that is called as acromion. To this acromion the clavicle comes and attaches. You have this clavicle, acromion, and this is the glenoid cavity. So the glenoid cavity, the ball is attaching. Glenoid cavity is the socket and the ball is attaching to this, and this is the humerus. Okay. The ball is the head of the humerus. This is the head part. Head has this particular ball-like structure. So answer is option number 4. Okay. Femur is attaching to, so this is a ball and socket joint. Femur is attaching to the acetabulum. So the femur attaches to the acetabulum, which is the socket for the hip joint. Okay. Femur, head of the femur is the ball for the hip joint. Pivot joint we just discussed between atlas and axis. Fibula is the bone which is actually present along with tibia. Knee joint it is forming. Okay, an ankle joint also. So in the leg region, in the thigh region the bone is femur. In the leg region it is tibia fibula. Okay, in the ankle region it is the tarsals. In the foot it is the metatarsal phalanges. That's all. Now the next question is this one. So they are asking you total number of facial bones in the human body. So actually I was telling you that in the textbook it is written 22 bones are there inside the skull. Okay, in this particular entire skull there are 22 bones. This is divided into cranial bones and facial bones. Okay, 8 cranial bones are there and facial bones it is 14 in number. Answer is option 3rd. Option 3rd. Okay, right. What is this 18? Does this make any sense? What is 80 here? 80 is the total number of bones in axial skeleton. Okay, how do you remember this? AXIS, axis. It has 1, 2, 3, 4, 4 letters. Okay, there are 4 letters. 80 is a multiple of 4, and there are 4 bones, 4 bone sets in the axial skeleton: skull, sternum, vertebrae, Skull, sternum, vertebrae, ribs. Skull, sternum, vertebrae, ribs. Skull, sternum, vertebrae, ribs. 4 sets are there. 1, 2, 3, 4. Axis, the word axis has 4 letters. 80 is the total number of bones in the axial skeleton. So everything matches, isn't it? So 80 is the number of bones in the axial skeleton. That's all. Let us go to the next question. The phalangeal formula for the forelimb. Phalanges are making the fingers. Okay, phalanges are making the fingers. So in the case of the thumb, there are 2 phalanges. Rest all fingers have 3 phalanges. Same thing in the toe also. Okay, same thing in the foot also. Okay, so you have a thumb. Thumb is the first finger. 1 and 2 phalanges. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. So this is 2, 3, 3, 3. In the thumb it is 2. Rest everywhere it is 3. So answer is option number 1. Okay, I'm going very quick over here. So I hope this is much understandable to you in this speed. So I'm assuming that you have seen the video, you have read the textbook once, or even if you have not seen my previous video, at least you have read or you have understood and you have memorized the concept from the textbook. Okay, only then we will be in a position to go in this particular speed. So if you haven't done that, I would humbly request you to do that first for some half an hour or 1 hour and come back again to see the video. Now, this is the next question. Okay, wrist bones. So what is the wrist? Carpal bones. Okay, this is the carpal bones. In the ankle, it is the tarsals. Carpal bones are 8 in number. Okay, ankle bones are the tarsals. Okay, ankle bones are 7 in number. I was telling you, carpals are 8 in number, but tarsals are only 7 in number. Palm bones are the metacarpals. 1, 2, 3, 4, 5. I have 5 fingers, so I have 5 metacarpals in the palm. So this will go to 5. Thoracic vertebrae C7, T12, lumbar 5, sacral 5, coccygeal 4. This is fused and this is also fused. There are 7 cervical vertebrae in the neck, 12 thoracic vertebrae in the thorax, behind the chest. Okay, there are 5 lumbar vertebrae behind the abdomen. There is 1 sacrum and 1 coccyx, which is made up of 5 bones and 4 bones. This is fused. Okay, that is how we write this. This is the vertebral formula. This has to be memorized, and we have discussed this in the initial part of the lecture. So 12, isn't it? 12 is the answer. So this is 12. And this phalanges, we have just discussed 2, 3, 3, 3, 3, 5 fingers. Thumb has 2 phalanx, rest all 3 phalanx, 3, 6, 9, 12, 13, 14. So this is 14. Okay, this is how the thing has to be matched. Okay, next question. Joints between the carpal bones. Joints between the carpal bones. Gliding joint. Okay, so this is the answer. Gliding joint is the answer. We have discussed now, isn't it? Now, if you want me to show you what I have done in the class again, for you to discuss this again, we'll also do that. Okay, so this was the notes that I made in the class. Okay, so synovial joint, this simply means that you are having a synovial membrane that is lining the joint. In this you have a synovial cavity, and this cavity is filled with the synovial fluid, okay, as it is given in this particular image. So this is called as synovial fluid. Ball and socket joint is the first type, and that is shoulder and hips. Okay, hinge joint is the knee joint, so you can move it in this particular direction. That's it. That is called as hinge joint, right? Never forget that. And even this particular joints are also hinge joint between the fingers. These are all hinge joints. Okay, this is how you move your knee also, isn't it? You can just flex it, extend it, flex it, extend it. These are also examples of hinge joints. Knee joint between the finger, between the phalanges, you have the hinge joint. Okay, then the third one is the pivot joint. So as I was telling you, axis has a projection like this. On top of that, atlas is there, so it can move in this particular direction. That is called as pivot joint. Now gliding joint between the carpals. Carpals are arranged in this particular area, so they can just glide in between, but it cannot move away. That's all. That is between the carpals. And finally, saddle joint is between the carpals and metacarpal of the thumb. Okay, this is the metacarpal, this is the carpal, metacarpal. This joint is the saddle joint. So these are all the types of the synovial joints that are given in the textbook. We have just now again revised what we have discussed in the class. So yeah, that's it. Okay. So this is gliding joint. So all types of joints that are there in the textbook have been given in this particular option. So answer for this question is option third. Next. Find out the incorrect statement. Bones present in the wrist and palm are called as carpals and metacarpals. Okay, bones in the wrist, carpals. Bones in the palm, metacarpals. We have seen that, isn't it? Is it a correct statement? Yes, it is. The joint between atlas and axis is a pivot joint. Yes, obviously, we have discussed that. It is a correct statement. A single U-shaped bone, hyoid, is present at the base of the buccal cavity. So here you have, this is the buccal cavity, mouth. And below this, if you feel here, you will see that particular U-shaped bone, and that is called by the name of hyoid, isn't it? And it is also included in the skull bones. Yes, skull, although they have said in the textbook that 22 bones are there, but the mistake is that they have not considered the ear ossicles. Where is the ear? Ear is inside the temporal bone. Now temporal bone is a bone of the skull. Now ear, in this ear I have 3 bones, malleus, incus, stapes. In this ear also I have 3 bones. So 3 plus 3, 6 are there. So 6 ossicles in the middle ear of each bone. I mean 3 plus 3 is 6, and then you have a hyoid bone, that is 1. Okay, a single U-shaped bone here. So altogether this will give me 29 bones, and that is the correct answer. That is the actual answer that you need to give. Okay, so total you have 29 bones over here in the skull actually. Okay, but there it is written that there are only 22 bones. They are not considered in the textbook, 6 ossicles and 1 hyoid. So that's it. Okay, so remember it in this particular way. So if they ask you in the NEET that how many bones are there in the skull, your answer is 22. Because that is how it is given in NCERT. But remember this particular correct idea also. Each middle ear contains 3 tiny bones called as ear ossicles. Obviously, you have a malleus, which is somewhat like this hammer-like structure. Then you have an incus. This is attached to a small stapes like this. Stirrup. So this is the stapes. Now this is attached to the oval window of cochlea. Neural control and coordination consists. This is attached to the tympanic membrane or the eardrum, isn't it? So obviously, is this a correct statement? Yes, it is. This is a correct statement also. The mammalian skull articulates with the superior region of the vertebral column. So what is this? The superior region, upper region of the vertebral column is the atlas, first vertebrae. So the skull joins with the uppermost portion of the vertebral column. This is my vertebral column. Many vertebrae are there. On top of that I have the skull. And this first vertebrae to which the skull is attaching is the atlas, with the help of single occipital condyle. So this is wrong. This is wrong. It is not single. There are 2 occipital condyles. There are 2 occipital condyles, and that is why you call it as the dicondylic skull. Dicondylic skull. Very important question. So in humans, as it is given in the textbook, the mammalian skull, in mammals, you have 2 occipital condyles. So these are certain projections of the bone. So it is present in which bone? Occipital bone. Okay, that's it. In the occipital bone, base of that occipital bone, you will be seeing this. What other structure do you see in the base of the occipital bone? Foramen magnum, through which the medulla oblongata comes down as the spinal cord. It continues as the spinal cord through this particular structure, that is foramen magnum, isn't it? So mammalian skull articulates with the superior region of the vertebral column with the help of 2 occipital condyles. So is this a false statement? This is wrong. So option 5 is my answer for this question. Next one. See, the pivot joint between atlas and axis is a type of synovial joint, obviously. Fibrous joint, cartilaginous and synovial, three types of joint. Saddle joint is a type of synovial joint. Okay, that's it. We have been discussing this again and again in this particular session, isn't it? Now, do you know this osteoporosis? This was a question that was asked in the previous NEET exam. We were saying that osteoporosis, it is seen in females, isn't it? So it is seen in females, most commonly in females after menopause. Okay, what is the age of menopause as per NCERT textbook? 50 years. So after 50 years, as per NCERT, all females are stopping their menstruation. So they will have a stoppage of their menstruation by 50 years. So after 50 years, what will happen? The estrogen levels will decrease. Okay, so estrogen levels will decrease. When estrogen is decreasing, the bone becomes fragile. Okay, because you know estrogen is required for the bone integrity. So if the bones are becoming fragile, then there is an increased chance of fractures. Okay, so that is why when old people fall down, they have an increased tendency of getting fractures compared to people like us who are falling down. So we keep on falling down in our childhood. Even now we will fall down. Still, we don't get so many fractures as compared to a person who are of an old age falling down. Why? Because of osteoporosis in old age. So decreased level of estrogen is my answer. So the correct answer is option number 1. Accumulation of uric acid leading to inflammation of joint. This is called as the gout. Okay, uric acid crystals. So this uric acids are there. This will form crystals, and this crystal will be present in the synovial cavity, and that will cause tremendous pain, especially when they wake up or they sleep for some time, and during the sleep they wake up because of this excruciating pain. Right? Immune disorder affecting the neuromuscular junction. What is this? Leading to fatigue. We will discuss this in the coming lectures. This is called as myasthenia gravis. Okay, it is an autoimmune disorder. Which other autoimmune disorder did you learn now? You also learned about rheumatoid arthritis. It is an autoimmune disorder. Your own immunity is attacking yourself. I have an immunity. It is supposed to attack the germs, but it is attacking me. Okay, I have kept certain soldiers, and the soldiers are now starting to attack me instead of other people, isn't it? So that is what is meant by autoimmune diseases, and two examples are myasthenia gravis and rheumatoid arthritis as of now. High concentration of calcium and sodium, no, nothing to do with this. So this is the discussion for this particular question. Let's go to the next one. So here, as you can see, which of this is not an autoimmune disease? This is also a previous year NEET question. Psoriasis, vitiligo, these are skin conditions. Okay, these are all autoimmune diseases. Okay, nothing more you need to know about them. These are all big topics in dermatology. So yeah, skin diseases. So these are all examples of autoimmune disease. Rheumatoid arthritis, we just now learned, even in the textbook, in NCERT textbook of 12th standard, where this autoimmune concept is discussed over there also rheumatoid arthritis is given as an example. Alzheimer's disease, no, this is not an example of an autoimmune disease. Answer is option number 4. You can find this by ruling out the option, but you need to know that vitiligo and psoriasis are examples of autoimmune diseases. Alzheimer's, the patient will have memory loss. That is the point, isn't it? So this is the basic idea that you are supposed to know in this particular level. So yeah, that's it. Let's go to the next question now. This is a good question. Previously asked NEET question on osteoporosis. So osteoporosis is a high yielding area. That very basic idea, they can fetch you a lot of marks. Which of the following hormones play a role in osteoporosis? See, the point is that it has been described only estrogen in the textbook, isn't it? Estrogen is described in the topic of the locomotion movement. So only one option has estrogen, so that is my answer. Option number 1. Answer is 1. Just by knowing that estrogen is the answer, I can find out the answer here. But along with estrogen, there is another one that they are giving, that is parathyroid hormone. Basically, in your body, there are 3 hormones that are required for calcium metabolism. See, the bone integrity, or wherever calcium is required, that is maintained by three hormones. One is the thyroid hormone. So I can see that thyrocalcitonin, isn't it? Calcitonin is the first hormone, and that is by the thyroid. Thyroid is synthesizing calcitonin. Second is parathormone, parathyroid. Okay, parathyroid hormone or parathormone is the second one, and the third one is vitamin D. That is why they are asking you to stand in the sun for some time. At least you need to have some exposure to the sun. So this is the sunshine vitamin. You will get this particular vitamin. Your body will produce vitamin D on its own when you are exposed to the sunlight. That is why it is called a sunshine vitamin, sunlight vitamin. So these are other names for vitamin D. So these are all the things that are actually helping you in calcium metabolism. Okay. Now bone is also made up of calcium. So actually they are affecting the bones. So only one option from this is given here. You can just remember these three names. And yes, for osteoporosis, we now got one more hormone, that is parathormone. Okay, parathyroid hormone. So this is given in the options. So this is how the whole thing is importantly mentioned in the textbook. So parathormone and estrogen are actually affecting the calcium metabolism. And obviously it has some role to play in osteoporosis also. That much of detail is required at your level. Okay, so we are doing a revision class. We don't have to go into so much of details. So our aim is to crack this exam in the easiest possible way with the correct amount of hard work and correct amount of approach that you need to put in so as to crack the NEET exam, right? So the last question for this particular session is from the topic of this particular image only, from the topic of pelvic girdle. Okay, this was a question in a practice test that I wrote when I was in class 12. Okay, so just talking about this with you. So see, they are talking about a foramen. Foramen means a hole. Okay, so this word foramen, when you talk about the word foramen in any bone, you are meaning that there is a hole here. So there is a hole called by the name of obturator foramen in the pelvic girdle of mammals is formed by. So in the pelvic girdle, I have three bones. What are the three bones? Ilium. I haven't written that in this particular lecture, isn't it? Ischium and pubis. Okay. So these three things together will form the bone called as the hip bone or the coxal bone. Okay, and I was telling you that they should have marked something like this and then they have marked coxal bone over there. But when this particular image will become difficult if they are just marking the ilium and showing that it is the coxal bone. No, the whole thing is the coxal bone. Okay, that is the difficulty when you follow these NCERT diagrams. Try to understand where is this thing is there, where is this obturator foramen there. Okay, see, this is the obturator foramen, the small hole here that you can see here, this is the obturator foramen. Okay, now tell me what is actually the boundary for this. On top it is by the pubis, on top it is lined by the pubis, on below it is by the ischium. Top it is by pubis and below it is by ischium. You have a hole here and that is the obturator foramen in the pelvis. Ilium is above. This is ilium. This is ilium. Pubis is between and they have an ischium over here. Okay. In between you have the pubis. And between pubis and ischium, this small hole is there that is not given in NCERT. That is given but not marked in NCERT, and this hole is called as obturator foramen. Okay. So with this I'm coming to the end of this particular video. So here the answer is pubis and ischium, isn't it? Okay. So in the next lecture we will start with the muscle and other concepts of muscle. Okay. I hope you are enjoying this series. So if you like this, please like, share and subscribe to my channel. Click the bell icon to get notification whenever I upload these kind of videos on YouTube. Thank you.